Hey there, everyone. I'm Dr. Jolene Brighten, and today I am joined by Courtney, who's going to be sharing her birth control journey with us. Welcome, Courtney, and thank you so much for taking the time to chat with me.
Oh, yeah. No, thank you for talking with me as well. I'm excited.
Awesome. So let's dive in. I would love to begin with, how did you get on birth control in the first place, and what was that like for you?
Well, I started when I was in high school. I was 16 years old, and it was kind of originally because I had bad skin, and my mom had heard, oh, well, it's great to clear up your skin, so why not? And, being worried about a high schooler, naturally, she was kind of passive aggressively saying, and if you're being sexually active, we're good there. So there were kind of dual reasons there. And I kind of just stayed on it. Periods were good while I was on it. I didn't see a problem with it, but I mean, I was in high school. I didn't know any better and didn't have any issues, didn't wind up with babies. So it was doing what it was supposed to do from that standpoint. And last year was when I decided to get off of it. And the reason for that, it just kind of hit me like a ton of bricks one day, where I used to do natural bodybuilding and I was very anti-steroids. And I was just thinking about it one day and I kind of went, steroids are synthetic hormones. Birth controls are also synthetic hormones. So why is it more okay to be on birth control?
Mm-hmm.
So at that point, I kind of went, I should probably talk with my husband about getting off of it and taking alternative routes for preventing pregnancy and what have you. So finally, when I was originally supposed to renew for my next cycle of pills, I told my doctor that I wanted to just be off of it, just because I know you're more balanced without it in time, what have you. And she said, well, oh no, if you don't want to have babies, you need to stay on this.
Mm-hmm.
So I kind of went, okay, sorry, it's not up to you. so, so I just kind of weaned myself off of it. I just stopped taking them, didn't renew my next cycle of pills, and oh my gosh, fresh slice of hell for several months. So,
Yeah.
yeah,
So did the birth control, when you got on the pill, you got on it for your skin, did it help with that?
a little bit. I mean, I was a sophomore in high school when I started it, and I remember it improved a little bit, but I would still get like breakouts throughout the day or not throughout the day, throughout the month, things like that. And I remember my senior year, my mom said, oh, hey, have you heard about Accutane? She worked in surgery. So she said, all these doctors are talking about it and it works really well. So I kind of went, oh, okay. I want better skin. Sure.
Mm-hmm.
So I did that for, I think, like 6 months, and that helped. But then afterwards, years later, I'd still get little breakouts. So that even didn't fully do its job like it's marketed.
Mm-hmm. Yeah.
So
So, and did you have any other side effects on being with birth control? Because you said like your periods got easier, your skin so, not totally better. You had to use Accutane on top of that.
mhm.
Anything else come up during that time?
Symptom wise, not really. I think it was more the physiology of things that were happening that I wasn't conscious of until I started getting more into sports, physical training, and different coaches were saying, hey, is there anything I need to know? Like, are you on certain medications? Do you have diabetes? Because you do not tolerate carbs very well.
Mm-hmm.
And when I was prepping for bodybuilding a couple years back, I remember doing a good hour of cardio 6 days a week, plus my lifting, plus eating only veggies for carbs. And I mean, that's a lot. And so it kind of didn't hit me until then, where I went, this is a problem. Like, everyone else I know can still tolerate carbs, but if I even introduce up to like 50 grams of carbs a day, that's where I start gaining weight.
Mm-hmm.
Like, it got really bad. And that's when I finally went, okay, I need to get off of this.
Yeah, well, and part of why that happens is because birth control actually induces what we see in pregnancy, like this mild insulin resistance.
Mhm.
So there's the insulin resistance piece to that, but there's also the piece that it's grabbing onto all your testosterone. And so, what
Mhm.
a lot of women who are, bodybuilders or even competitive athletes will say is that they have trouble putting on muscle mass, and they find that their body actually wants to put on fat and not muscle. Was that true for you? You're nodding your head.
Yes. Yep. I went through a phase of it not being challenging to put on muscle, but at the same time, I started working with a functional practitioner, and we did some lab work, and he said, oh, maybe the reason for that is because your testosterone's a little bit elevated. Maybe we're looking at PCOS, and that might be why you're not having a horrible time putting on muscle. But it was a brief period of time that was the case. Most of it otherwise was, like you said, gaining fat, having a harder time putting on muscle or seeing the muscle coming on. So,
yeah. And that's incredibly frustrating when you're like, I'm putting all this energy into like shaping my body and I can't seem to make it budge. So how long were you on hormonal birth control?
It was a total of 9 years straight
Okay.
without coming off of it or anything. So
yeah. And because you started it, because you had acne 9 years straight, did you find that, so you alluded to the fact that things were not like, you know, sunshine and rainbows when you stopped. So tell me a bit about that. What happened when you stopped?
Oh man. Well, working with a functional practitioner at the time, I told him that I wanted to come off the pill and he said, that's great. You're a lot more balanced when you're not on it. Good decision. And he said, however, just understand, you're not going to feel great for the first couple months, maybe even several months, depending. So we'll have to kind of look at reassessing labs and things like that, just to make sure we can ease the discomfort and any problems that might come along the way. So it was, I think if I remember right, it was last May when I came off of it. And I remember we did, at the time, before the Dutch test especially became more popular and things like that, we did saliva for hormones. We did a stool test for gut bacteria, all that. I had candida.
Of course.
And that was a nightmare. Oh my God. I remember it was like any food I put in my mouth, it made me like super bloated and gassy. And it was super uncomfortable.
Oh man.
And so he put me on, what is it? It's the low FODMAP diet. So we did that temporarily.
Did you have SIBO as well? Were you tested for SIBO?
No, I asked him about it because I noticed all the foods that were kind of bugging me were similar to that of the high FODMAP foods. So I said, hey, would it maybe be a good idea to try that for a little bit? And he said, from a food sensitivity standpoint, sure. But he said, understand it needs to be temporary. It's not like a full-time thing.
Good doctor.
Yeah. So we did that. That helped. And we reassessed hormones this past fall. And granted, it was with saliva. So who knows what was really going on. But it was like my estrogens were all super low, like postmenopausal low. And that freaked me out. And my husband and I aren't planning on kids, but at the same time I went, well, oh my God, if I want the option, like I need to get these better.
Totally.
So I actually just ran a Dutch cycle mapping complete just to look at everything, make sure we're not missing a beat. And it's actually the other end of the spectrum. It's estrogen dominance, way too much progesterone, and we're working on that now. So yeah. Yeah.
So, well, what I see with that often is that, so your brain and ovaries weren't talking for almost a decade. So when women get off the pill, we'll typically see they can have low estrogen. And that's part of why they won't actually have periods. And did you lose your period? Did it come back right away?
That's where I'm kind of curious as to how things were going physiologically with me, because I still had them fairly regularly. I noticed kind of a short luteal phase they'd cut off at 25, 26 days, but they were still fairly regular. They were just, oh my God, I would get so distended in the abdomen, and symptom wise, they weren't fun. But as far as regularity goes, they were still pretty regular.
Were they heavy or were they light? I'm sorry, I'm just very curious.
They were a little bit heavier, but they were okay when I was on the pill too. So to me, it wasn't that big of a difference, but I did notice had to use like super plus tampons and change them more frequently. So yeah, it definitely was heavier.
And yeah, so I mean, it could have very well been that your estrogen, like doing the saliva testing, maybe wasn't so accurate. But what I was going to say is that sometimes we can see the low estrogen and then the rebound happens. So we know there's an androgen rebound, but there can also be this estrogen, like your body's like, oh my gosh, we can make estrogen on our own again. And so what can happen is then you flip into a state of estrogen dominance, which while you were on hormonal birth control, it was its own state of estrogen dominance. And then it was messing with your microbiome. Yeast overgrowth is very common. So is SIBO with women who have been on birth control. And with that, because you've got gut dysbiosis, like until that's really resolved, those bacteria will actually reactivate your estrogens. And so even if you're making a little amount, you can actually have more estrogen than your body was planning on dealing with because of what your gut is doing with the estrogen. And so I'm glad that you're getting that thorough workup and looking at your hormones and looking at your gut. It's always, I have women who come to me and they're like, well, my doctor's working on my hormones. I'm like, what about your gut and liver? Like there's this whole other system that is impacted by your hormones and also impacts your hormones.
Oh, right on, for sure. Yeah. And actually, I was going to mention too, on my Dutch test, I had low methylation activity too. So it's like, oh, now you know there's part of the culprit for the high estrogens and metabolites and all that too. So,
And that's what we can see too with like, so having heavy, painful periods, breast swelling and tenderness, like clots in the menstrual blood. Sometimes that's why I love the Dutch test, is because sometimes estrogen's looking low, but then you see what you're doing with the metabolites and you're making tons of dangerous metabolites, like dangerous in the sense that they can stimulate the wrong kind of growth, like cancer cell growth over time. And so that's something that we also see, is that even though the estrogen looks low, what you're doing with it isn't right. And why is that? Because the birth control pill has messed with your liver really hard, and it's your liver's job to process those estrogens and put them in the right pathways.
Yeah, absolutely.
So so you got the Dutch test and all that. Did you experience like any mood symptoms? Was there like acne with a vengeance that came back?
Oh yeah. The acne didn't really come back. As long as I kept my diet lower carb, it was fine. If I up my carbs when my period's kind of coming around, that's where I get breakouts, especially around the jaw.
And when you say carbs, are you talking like bread, potato chips, or are you talking sweet potatoes?
Sweet potatoes, more gluten-free carbs. I'm more of a like modified paleo, if you will. Like I'll have some grains, but the gluten-free grains.
Yeah.
So things like that. Like if I had a really intense training day and I worked out really hard and I upped my carbs a little bit and my period's coming anytime soon, that's where I'll get a little breakout, but it's still nowhere near as bad as it used to be. So there's that.
Yeah, because that's something that I've seen in my clinical practice, like when the breakout is coming, because like gluten-free carbs are like refined sugars, like I always like my son is always wanting like gluten-free bread, and I'm like, you better put a lot of butter on that, kid. Like you gotta have stuff for that. But with that, we found that like, well, if the carbs instead are focused on things like green beans and sweet potatoes and squash, because a lot of us ladies do better with a little higher carbs, like right before a period comes. I mean, it makes sense because your body's like, maybe we're pregnant, maybe we could have a baby.
Right.
And that has been something I've seen be a really big difference, is like whether you're eating grain-based carbs or you're eating vegetable-based carbs. But you've got the added effect of a yeast overgrowth going on. And so anything that feeds yeast is going to cause inflammation in the body, and that can just make skin go crazy for sure.
Oh yeah. Absolutely. And I've noticed dairy too. That actually makes it act up more than carbs do.
Absolutely.
So I'm pretty good about avoiding that. If I have it, it's usually like some Kerrygold here and there. Otherwise, heavy cream, milk products, no.
Yeah, as soon as I said put butter on that and it came out of my mouth, I was like, well, butter's not the best option necessarily if you have acne. I have a very good friend who's a PCOS expert, and we talk about how like both her and I will get cystic acne outbreaks. She has PCOS, I do not, if we eat too much dairy. And so we were at an event and I was like, I don't have anything to do in the next week, and I really just want to have a piece of cheese. And then sure enough, like underneath my jaw, there it was, like 4 days later. I'm like, well, we just tested that hypothesis again, and it stays true. Dairy seems to be a universal one for acne. And so, definitely for women who are listening to this and are struggling with acne, it's a good idea to consider cutting that out just for a period of time at least. Yeah. So I'm curious. So we connected on Instagram. How did you first come across my work?
I finished the schooling for the FDNP credentialing a while ago. So getting into functional nutrition, things like that. And then I was like, oh my God, she's a women's hormone specialist. I need to follow her. I need to learn more. I need to see more of what she's about, things like that. I just really like following other practitioners that abide by natural medicine, functional medicine, integrative, what have you. And so that's originally how I came across it. And then I saw all this post-birth control syndrome stuff you were putting out. And I was like, oh my God, that is me to a T. And I was like, oh my God, I'm not the only one. This is so kind of refreshing to hear. So that's originally how I came about it.
Yeah. And that's why I'm so grateful that you're sitting here telling your story today, because this is what happens. I mean, I've had thousands upon thousands of messages coming to me where women are like, I think I'm crazy. My doctor says I'm crazy. Like, is this real? And they'll so often say, I mean, it's almost universal. They'll say, I thought I was the only one. And then I heard someone else's story. My friend told me it happened to her. And in that moment, I knew I wasn't making this up. It wasn't in my head. And that's why it's so important, I think, as women, that we share our experience, we share our stories. And so I just want to say, I'm super grateful that you're here being completely honest. Nobody wants to talk about their acne problems, but you're doing it. And it's going to help so many women.
Yeah. Yeah. No. And I wanted to thank you so much for having me, because the more I read about all this stuff, the more I learn, the more I see it with my own clients that I train and do nutrition with. It needs to be discussed, because so many people, like you said, don't want to talk about it. And not only that, but there are different results that people are going to get when they come off the pill too, that hearing the different stories, I think, helps a lot as well.
Yeah. And it's why so much we need to work with, like, I think we need to have a healthcare team for sure. I mean, most people know, like, if you come to my medical practice, you have to work with my nutritionist as well. Like, we've got to have a team approach on that. But
Mm-hmm.
we need more clinicians talking about this for sure. But we also need more women sharing their story, because it doesn't look the same. And that's what
Yep.
confuses so many doctors, because when you're in medical school, they're like, here's the textbook and here's the algorithm, and patients like never present like the textbook. And so that's where, like, working with functional medicine or naturopathic physicians can be so beneficial, because we are more used to seeing the outliers and understanding that there's a spectrum of health, just like there's a spectrum of disease, and
Yep.
there's a spectrum in how post-birth control syndrome presents. And it's a lot like why I think it hasn't gotten the attention it deserves, is because doctors feel confused by it. And,
Mm-hmm.
you're somebody who is training and actually understanding the physiology of the body and how to leverage food as medicine. It's those basics that we have to employ in order to really move the needle in post-birth control syndrome.
Yeah. Yeah, definitely. I have a client who, she's like the walking testimony of what's to come. And granted, I'm not a doctor. I don't say, hey, you need to get off the pill. Because at the end of the day, I'm like, hey, physiologically, this is what it can do. It's your choice. But I just, like, we were talking about it a while ago, and she's like, well, I feel fine while I'm on it. And to me, I think that's the biggest thing I want other women to know is, okay, you feel fine while you're on it. I'm talking about when you come off of it, what's going to happen. And that's the biggest thing for me that hit me like a ton of bricks, where I was like, oh my God, they aren't kidding. It's totally different when you come off of it.
Yeah. Well, and in doing these interviews, I've had women say to me, I thought I was fine. I had an IUD. I thought I was fine. I chalked it up to this or that. I was on the pill. I thought I was fine. And it was when I came off that I finally was like, wait a minute. I feel like myself. Like, this is the moment where I felt most like myself. I actually know when I'm ovulating. I know when my period's coming. I don't need this artificial measurement. Like, a lot of us feel very confused by our menstrual cycle. And, what's always, I think, startling to women is when they were put on the pill, like from day one, they had their period, they're put on the pill from day one, and then they get off of it and they have their first regular cycle in like 10, 15, 20, sometimes even longer years. And they're like, whoa, there are a lot of shifts and a lot of changes going on. And in a lot of ways, they feel like they got gypped and they were missing out. So, it's also something too that whenever women are like, I feel fine, I'm like, well, what does your lab say? Because you may be walking around making excuses for why you feel so bad, saying things like, oh, I'm getting older, or depression runs in my family, or, I just have food sensitivities. It's just the way it is. I mean, fill in the blank. We really, as women, we come up with a way to barter so that we can keep moving and one foot in front of the other. And that's an awesome skill to have. But at the same time, I have never had a woman in my office on hormonal contraceptives not have inflammation, not have an elevated CRP. And the research shows this. And what is the fastest way to get chronic disease? Inflammation. Like, so it's something where it's like, you may be thinking you feel fine. And when we do lab testing, you're anything but fine.
Yeah. And I can actually relate to that too. Anytime we did blood testing, my CRP, AST, and ALT always elevated. And initially in my head, I'm like, oh, maybe I'm training too hard, because I was in bodybuilding mode at the time. And I'm like, oh, just scale my training back, maybe eat some more anti-inflammatory foods. Well, there's a lot more to it than that. And my functional medicine practitioner, he was just kind of saying, okay, you're not wrong. Like, yes, you could do that too. But he said at the same time, you're on birth control. So there's that. He's like, come off of it and you might still be inflamed for a while. But he said in the long run, it's going to be a lot better for you to not be on it.
Yeah, for sure. And so for people listening, a CRP, a C-reactive protein, is a marker of inflammation. ALT and AST are liver enzymes that are indicative that the liver is under stress and even, maybe developing a disease. And the liver is so impacted. It's why one of the first things I tell women to do is do a liver detox. Like, a physician grade liver detox supplement is loaded with like antioxidants and everything your liver really needs to do its job. But what a lot of women don't realize is that within medicine, we didn't diagnose liver tumors in women at the rate we do now. Like the introduction of the pill, we saw skyrocketing of liver tumors. And what makes me laugh is that the research will say, and in doctors' educational classes, they'll say, well, they're benign. Oh, they're benign. Well, it's still a tumor on your liver.
Right.
It is still a tissue change that now that tissue is basically worthless happening in your body. Oh, and by the way, you're at a really high rate of having that rupture. So when you're talking to someone who's like an athlete, like, hold on, you're on the pill, you might have the liver tumor. And if you like do something where you jar your abdomen, like, or let's say you get in a car accident, you could bleed out because the liver is getting a lot of blood flow every day. And this is just one of the many things I wish doctors would be talking to women about, because sure, it might be a benign liver tumor in that it's not cancer, but it's still a tumor on your liver. Like, this is no joke.
Mm-hmm. Yeah, for sure. Another thing I wanted to bring up too, a while ago, I listened to a podcast with you and Dave Asprey, and you guys were talking about different things like post-birth control syndrome versus how your hormones change after pregnancy, things like that. And I remember there was a part of the podcast where I just like stopped and it just hit me like a ton of bricks, where you guys were discussing how if you're on the pill and say you're dating someone and you've been together for a while, it actually kind of changes the way you choose a spouse or a potential spouse. And I thought about that and I was like, oh my God, my husband and I, like, we don't have issues or anything, but I was like, we are so alike. And granted, maybe that's personality. Maybe that's just something I did prefer anyway, which, thinking back on it now, I mean, I think our relationship's even better that I've been off the pill, but that just hit me like a ton of bricks. And I remember talking to him about it and I said, hey, maybe we shouldn't have kids, because maybe they might wind up with some serious health issues because we're so alike.
Well, you can always get genetic screening and there's right. People that can help with that. But, you know, this is a big question I think that science should really be investigating, is like, look, if we're medicating women so that they choose people more genetically identical to them, then what are we doing to the future of the human race? Like, how is that going to impact our genetics overall? Mm-hmm. And, you know, the funny thing about me is that, so I met my husband, and my husband now, I knew him for 10 years. He was like in love with me. I was like, whatever. And it wasn't until I got off the birth control, like we were in college together, sat next to each other in classes. I got off the birth control pill. We ended up hanging out again. Like it was like 2 months later, 3 months later, something like that. And we were inseparable from that moment. I was like, how could I not see it? Like within a week, we were like saying, I love you. We wanted to move together. Like it was incredible and insane when he's like, I was in love with you for like a decade. How did you not know? And I'm like, are you serious? And the biggest thing that he like, as I like set out to write my book and I was talking about this stuff, and he's like, do you remember how addicted to my smell you were? Like you would like he's like, I would ride my bike and be sweaty and you'd be like, oh my God, I cannot smell enough of you. I'm like, oh my God, it's so true. It was like, you were probably stinky to someone else, but to me, I was like, this is everything. And that's something that gets completely muted while we're on the pill. We can't pick up on those pheromones in the same way. And we're not going to be attracted to somebody who is genetically, you know, as different as possible to us. So it's something like I love Dave, and I loved in that podcast when he just laid it out and was like, look, I'm going to say it because I'm more take the road of like, I'm going to support you wherever you're at. And he's like, no, if you're a man and you love the women in your life, then you will get them off of this. You will not ask them to take this. And I think that was really powerful because so many of us end up on birth control because men are like, no, you're the one that can get pregnant. You have to be the one to like manage this. And so I'm glad to hear that you had a supportive partner in this. Have you noticed anything with like your relationship, like in terms of transitioning off?
Oh yeah. Initially it was kind of tough because I remember like he works different hours than I do. So one night I remember he went to bed before I did and I was up. I was reading I follow a few marriage counseling pages on Instagram just because, I mean, who isn't working on a few things in their marriage?
Everybody. And if you're not, there's something wrong.
Right. And I remember there was something that just hit me like a ton of bricks and I started like bawling and I'm thinking we have these issues and it's like going down the drain. And then I wrote this like long note for him to read in the morning. And I remember he sent me a text when he was on his break the next day. He's like, what was that note about? Are you feeling okay? And I said, no, I just thought about it. And I was totally fine the next day. I was like, no, I just thought about it. And I think we should prioritize that a little bit more. And I acted like it wasn't a big deal, but this note was super dramatic and super kind of depressing the way I wrote it. And then I read it again and I was like, oh my God, what did I just say to him? Of course he's reacting the way that he is. And initially it was this roller coaster of sadness, and then, oh my God, we're doing so great. And then, oh my God, no, we have a lot we need to work on. And then now finally I'm like, no, we have probably a healthier relationship now than we ever have, where we resolve conflicts a lot better. We aren't dealing with, this roller coaster of emotions, and things are a lot better now for sure.
Yeah. And that's super common as part of post-birth control syndrome too, as for there to be like the emotional roller coaster of ups and downs. And, in some way, I haven't come across any research in this, but in the patients I work with, like there is a lot of questioning about the relationships around them. And what there is research about is that we do interact differently. When we're on birth control, we interact differently with like children, friends. Like there's a lot of changes that are happening in the female brain that we do not yet understand. But this questioning of relationships and this questioning of like, what is my place in this relationship? And is this the healthy relationship? And I've had patients who are like, what was I ever doing with this guy? And they get divorced because they're like, this was never like, I was never happy with this. And I put up with this and he's not happy. And then, they figure that out. And, but I've had women as well who are like, oh my gosh, like my entire life as a mother, I didn't feel connected to my children. Now that I'm off of this, I feel like the mom I always wanted to be, and there's so much more connected in. And so I think we need a lot more relationship research coming out about like what is going on with this. But something I hear all the time from my patients is like just the emotional roller coaster, and then the questioning of like, what is the value of this relationship? What is my role in this relationship? And we start to question a lot of life decisions, I think, as well. And I don't think it's unhealthy. It's uncomfortable, but like all wonderful things that help us change, they're always uncomfortable. Yep. And I just want to say kudos to you for doing the hard work and for staying with it. Because it's always, I think so often in society, one, as women, we're just supposed to always smile. But the other thing too is that we are conditioned to believe that there's always a pharmaceutical to help you avoid the next level of pain. And, it's like, I mean, why is aspirin and ibuprofen sell like gangbusters off the shelf? Is because we believe we should never have to feel pain. But there's so much wisdom and knowledge when you follow that down and you stay present with it. And you even get on Instagram and you write out your thoughts and do all of that. I mean, that's a painful process to go through. At the same time, like there's big rewards on the other end of that.
Yeah, I agree for sure. I remember initially I didn't want to write about it because with that, I mean, there's some body dysmorphia that goes along with part of this journey that I had. And naturally, birth control aside, that's a bodybuilding thing. It's really common. And
I was a group fitness instructor. I still have body dysmorphia issues. So I just want I own that, where it's like, I'll be fine. There are some days where I catch myself in the mirror saying I'm fat. And then my 5-year-old's like, is mama fat? And I'm like, oh, I just did it again. How did I fall back into that? So I just want to say that it's super common in women in general, and especially for everyone listening to this.
Yeah. And I remember after I came off the pill, I remember, following the low FODMAP diet and doing all this stuff to try to address it. Like I was still gaining weight, and I'm thinking, oh my God, what's going on? I'm so used to having this relatively fit physique, and now it feels like it's outside of my control. And I was like, that's the part I really don't like. Is I will say the one thing I enjoyed when I was on the pill is I knew what my body responded to. If I wanted to lean down a little bit, I knew what I had to do, and it worked. And then I was like, I got off the pill and I thought, I don't like this unpredictability. And my FMD kept saying like, just wait, it'll get back. It takes time. You will have it back and things will work a lot easier for you. So I kind of just waited it out, and the self-esteem, it's better now. It still needs some work here and there where, like you said, there are good days and bad days. But I remember initially when I came off the pill, there were days where it was so bad. Like my husband and I would go out on date night and I'd be putting on whatever I was going to wear. And I'd look in the mirror and I'd go, oh my God, no. And I'd put something else on. Oh my God, no, this doesn't hide my stomach. And I'd spend like a half hour getting dressed, and I'd have like this pile of outfits on the floor that just weren't okay.
I know about the mess. Oh man.
Yeah. So, I mean, it's not that bad anymore. Now I'm like, oh, this is cute. Whatever, I'll wear it. So it's better, but I mean, there was that side of the struggle as well.
Absolutely. And I really appreciate you sharing that so candidly and so honestly, because it is something you don't have to be a bodybuilder and you don't have to be in fitness. All you have to do is be a woman in this world. Whoever picked up a woman's magazine or gone on someone's like, inspiration board on Pinterest or follow somebody on Instagram. Like it's pretty like in society, we are told as women, our value is our body and our beauty. And so you having acne, being a bodybuilder, I mean, that's a real struggle and a real challenge, but it's something that so many women universally struggle with. And so like, I just want to honor that because this is going to help so many women to hear this. I mean, I remember, a good friend of mine when she was like, I have body dysmorphia and I've been a fit athlete my whole life. And when she opened up and told me about it, I was like, I actually do too. And let me tell you about my struggle. And I was very, very ashamed of it. But it's something that after speaking with thousands of women in my clinical practice, I'm like, honestly, maybe 5 of them didn't have issues with their body image because it is so ingrained in us in society. And I am really excited for the next generation who's kind of just like throwing like a big FU at like weight loss fads and like, trying to be the prettiest, skinniest next, whatever, like they think that you should be. I'm a Gen X. We had like, we definitely had there was that phase of like, very skinny women were the ideal. It's so funny to me because when the thigh gap thing came around and all my patients were saying to me, I don't have thigh gap, something's wrong with me. I'm like, so yeah, I thought something maybe was wrong with me too. I had that minute. And then I went and looked at pictures of me when I was like 12 and I was like, wait a minute, I didn't have thigh gap then. Like, why am I going to have thigh gap now? Like, that is not a thing for me. My sister, totally different body, like rocks it. That's her thing. But like, it took a lot of work to come to acceptance of like, I'm curvier. I put on weight. Like that is just the woman I am. And like, but it's still like, there's still the daily infiltration, I think, of like media that will creep in sometimes. And especially like when you're in the fitness world, like you're in front of people who are literally judging you.
Yeah. Yeah. And for me, it took me a while, but I finally decided of not competing again for many other reasons. But and that's another thing that being new to the FDNP and functional nutrition world, I hear ex-competitors that I don't even follow anymore because I'm just kind of sick of hearing it, to be honest. And not all of them are like that. I'm not trying to bash bodybuilders by any means, but some of them are like, oh, if your hormones are healthy and all this, it shouldn't matter, or you should be able to take healthy measures to getting to this stage. And I'm thinking, that's kind of an oxymoron because your body is not meant to be that lean. And when you're pushing it to get that lean, you're going to have to go to extremes, even if you are healthy, so to speak.
I can't even tell you how many ex-fitness competitors I have treated who have destroyed their metabolism, like who are now like, if I look at food, I'm getting fat, like, and there is no muscle, like my muscle is wasting and it's all fat, and like having to work with them. And I'm sure that you work with women like this as well, but like a big thing is feeding your body and telling your body that everything's safe. But I have, I don't know. That's not a world I work in terms of getting women to that place. I don't know if you can do that in a healthy way. What I do know is that I've treated the aftermath of this, and women, it tends to be like once women get into their later 30s and their 40s, like their body just is like, no more. We are done. And no matter what they do. And that's the most disheartening thing that I hear, is that they end up with me because now they're being told they're fat. They're being told they're ugly. They're being told that they're not doing a good enough job. They're not working hard enough. Like all of these really destructive things. And so they come to me feeling broken. And I'm like, no, your body's telling you no more. Like your body's done with this. And like, you have to respect it. And we've been able to work with them where they do get back to a healthy body composition. But it is something that is very, very hard on the body to go through that. And you're right. I mean, women, we weren't really designed to be this lean. I mean, we were designed to like grow entire humans in our body, which is pretty badass in my opinion.
Yeah, for sure. I agree. Another thing that I think, I don't know, to me, this is kind of odd, but I don't know if maybe you've experienced this ever, but I've had clients where they say like, oh, I saw you write this story about this situation you had with birth control on Instagram. And I'm just confused as to why you still have issues with this if you are able to practice functional nutrition and run labs on yourself. And I'm kind of like, okay,
so,
well,
I'm laughing here. I'm like, yes.
I'm like, okay, I'm a human too. I have issues as well. And that's why I'm trying to put it out there. That's actually a big part of why I'm writing it, is so you understand that, like, there aren't people that are perfect that don't have issues that are just writing about people who do have issues. I want you to understand I'm human too. We all deal with stuff like this. And not only that, but I actually don't evaluate my own labs. I let my functional medicine doctor do that, because when I do it, I've tried, I either overthink it or I tunnel in on one particular issue and forget about other important things too.
You're biased
So,
like that. I mean, that's the basis of science, is you can't enter into examining, studying, or testing any hypothesis if you're holding a bias. And you're holding a bias. You already are suspecting something's going on. But, I laugh about this because, women will say, I will share, like, so I just shared, like, not too long ago about how I had major breast tenderness before my period because I disrupted my routine. I didn't have my supplements with me. Like, there was all these things that went on. And I told that story to demonstrate that, like, even when you're a hormone expert, like, life happens and then you've got to course correct for that. But, I treat a lot of functional medicine experts, of naturopathic physicians, nutritionists. Like, I work with a lot of medical experts. And I also have my own medical experts that I seek help from, because, what I say to people is that when you're trying to navigate your own health, it's like holding a book that's too close to your face. Everything is there. It's all right there in front of you, but you're so close, you can't actually read it. You can't see it. You can never see it for yourself. And so you have to have someone who objectively stands back and says, okay, well, here's the whole picture for you.
mm-hmm. Yeah, absolutely.
So for women who are contemplating coming off of birth control, maybe they're feeling fearful, maybe they're scared of getting post-birth control syndrome, is there anything that you would share with them?
I guess if I had to point out, I would say, because I've heard this not just from myself, but from, like, many other clients, but you might feel fine while you're on it and think, like, oh, this isn't going to happen to me. I'm not having issues while I'm on it, so I'm not going to have issues while I'm off of it. Nope. I would say the sooner you get off of it, the less likely you're going to deal with a fresh slice of hell, as I call it, when you get off of it. So I would say look into the alternative methods. I know you're familiar with the DAISY and doing the body temperature method of tracking fertility and things like that. And I would recommend that. And a lot of people have a hard time trusting that. I know I did for a long time, but I do that now and it's working. So in short, the sooner you get off of it, the less you're going to deal with as far as issues go when you come off of it, or the shorter time frame you'll deal with issues, I guess you should say, and you'll just feel 1,000 times better if you wait it out and you just tough it out.
That's fantastic. And get support from people like you or me, because you don't have to go it alone. So for women who are listening to this and maybe they're wanting to, learn more about your story or follow your journey, where can they find you?
On Instagram, my username is Maximum Metabolism. There's an underscore in between the two words. I am on Facebook as well. The page is the same exact name, Maximum Metabolism. I share a lot of my personal story behind pre-birth control, now what I'm doing post-birth control, just different informational tidbits on gut, thyroid, hormones, all that good stuff too. So, yeah.
Fantastic. Well, thank you again so much for taking the time to chat with me today and to be so honest and sharing your story.
Yeah. And thank you so much for talking with me. I really enjoyed this. And I hope that even few or tons of women, either way, just if anybody gets benefit from it, that's awesome. So